India is considered to be one of the fastest growing countries in terms of population, due to which the country is suffering from inadequate healthcare including malnutrition, illiteracy and insufficient infrastructure. These issues are very precarious so far rural India is concerned. 72% of our population live in the villages and 9% belong to senior citizen category who are vulnerable to eye problems, especially the cataract. 1 out of every 3 blind people in the world live in India. Lack of awareness, poor quality of service, high cost of treatment and inaccessibility to service delivery point are some of the points of blindness causes in India. Long distances from remote and backward areas to cities where hospitals are located are major handicap in receiving treatment.
I conceived of Anugraha just after my retirement in 2003. After putting around 14 years service on the board of 2 oil companies, namely Oil India Limited and ONGC. The idea was that I must give back to society, and one of the options I had in mind for serving the community was to go to the healthcare sector. Since I come from village, I found a number of people in the village, they become blind because they do not get the cataract operations done because of many reasons. Main reason is about the poverty, and the hospitals are quite far off and they are also quite expensive.
Anugraha Drishtidan is known to be a major healthcare intervention for rural population to provide medical treatment to those suffering from eye ailments. Anugraha Drishtidan's major focus has been the tribal, rural, backward and remote areas. Our aim is to benefit women, children, old age people and those living below poverty line. 42% beneficiaries include senior citizens in the age group of 60 years and above, and about 48% women and children. We have quality of life to those suffering from eye problems. We provide cataract surgeries through latest techniques and free of charge to poor patients.
We are working in 20 states of India, particularly the backward states, and we have done more than 500 cataract eye camps covering lakhs of people. We have so far done around 33,000 cataract operations and distributed around 1 lakh spectacles. All the services from the Anugraha are free of charge, because they are meant for the poor people living in the villages. And we are lucky to get the support from many of the corporate sectors and also the individuals. Our plan is to make it cataract free. We are member of Vision 2020, WHO, the initiative for eradicating the blindness. And by 2020 our plan is to make India cataract free. And we are supplementing the efforts of many NGOs, organizations and national and international organizations in this regard. But at the personal level, I want that before I say goodbye, I must complete around 51,000 cataract operations.
We have a dedicated team of professionals working in various states. The team comprises of committed volunteers and paid employees. President President and Secretary along with the Executive Committee members plan and monitor all the activities. Our major aim is to reach out poor and needy people to provide them medical support. Hence, a cluster of 15 to 20 villages are identified and date is fixed for holding the eye camp in coordination with the district authorities. Adequate publicity is given to all the villages. Patients are examined by a team of doctors and paramedical staff to identify cataract and other cases of eye problems including glaucoma.
We do generally 50 eye camps every year, and we are going to the poorest of the poor remote places like Nagaland, Tripura, Assam, Andhra Pradesh, Bihar, Chhattisgarh. Our planning for our winter camp is we identify the area, the cluster of around 15-20 villages, and at one place we do the publicity in these villages and give the date and time where the people they come for our camps. In the camps, our team they examine the patients suffering from the eye ailments, and those who are requiring the cataract operations, they are identified, and those who are requiring the spectacles, having the low vision, are provided the spectacles, and those requiring medicines, they are giving medicines. All these three facilities are given free of charge, and the identified cases of cataract, we take them to the nearby identified hospital, which is really very good, and the entire expenditure towards transportation, boarding, lodging, their cataract operations, medicines, and bringing them back to the base is all free. And this is how we are providing these services at their doorsteps. And with this, thousands and thousands of people, they get the benefit.
Patients with low vision are given spectacles and others having eye problems are given medicines. After the operation, follow-up is done. Each team conducts 3 to 4 camps in a month. Mechanism and methodology and manage the project. Quality of service is the main consideration.